Okay, webinars. So hello everybody and welcome to the webinar today. Today we're presenting on the current activities and opportunities from the Nursing Network. This is the second in a series of 3 webinars that we have. And we've got a whole range of speakers to speak to us today and talk about some of the exciting things that are going on with the Nursing Network. So welcome and thank you for joining us. Just so that people are aware, we're not able to use the chat function. So if you've got any questions you want to ask, please put those into the Q&A box and we can look at those questions then. So my name's Natalie Bradford. I'm part of the Nursing Network. I come from Australia on the other side of the world. And so where I'm coming from, it's late in the evening. Really pleased to be joining with you. My background is, of course, in children's cancer nursing. I started children's cancer nursing back in the 90s and moved into academia a little while ago. And I've just been part of the Nursing Network for the last sort of 12 months. And I'm really pleased to introduce Mohammed, who's my co-moderator today, and he will be letting you know what we're going to be presenting today. So over to you, Mohammed.
Thank you, Natalie. So hi, everyone. So my name is Mohammed Al-Qudaimat. I'm PhD candidate at the University of Toronto, Canada. Also, I'm co-chair of SIOP Global Health Network Traditional and Complementary Medicine Working Group and a member of SIOP Nursing Network Steering Group. So I started my career as a pediatric oncology nurse in 2005, like 18 years ago, at King Hussein Cancer Center in Amman, Jordan. So I'm originally from Jordan, right now living in Canada. So I can still remember when I joined SIOP Congress for the first time. This was like in 2006 in Geneva, Switzerland, and it was very warm, welcoming. It was very. I was impressed with the inclusive environment that had there, and I've been told that I was the first nurse from Jordan to join SIOP Congress. And it was overwhelming feeling. So meeting colleagues and pediatric oncology legends and pioneers during that meeting helped me come up with my life mission as to help pediatric oncology nurses in low middle income countries. So that's why I'm here today. So I would like to thank again, if you attended the last webinar about the history of SIOP, I would like to thank so very much the panelists and the speaker, the moderators. It was great to listen to SIOP Nursing's story from the legends and pioneers of pediatric oncology nursing at SIOP. So today, it's again my great pleasure to be here and co-moderate this session with Natalie. And during this session, we're gonna cover a few items and topics. We try to feature as much as we can in terms of the important activities that SIOP nurses are doing right now. So as you can see on the screen, that we're gonna like go over the SIOP Nursing Network membership. We're gonna discuss the current challenges and opportunities, like acknowledging the impact of COVID-19. Also, we're gonna give like an overview of Nursing Network and membership, like 2022 achievements, strategic plan timeline, nursing engagement committees, networks, and working group. Also, we will have speakers who's thankfully joined us today and will speak about the quality improvement nurse schooler initiatives, SIOP Education Day Scientific and Ambassador Program, SIOP Congress 2022 Spanish Highlights webinar, Global Health Network Nursing Working Group, and then baseline standards and My Child Matter grant. So finally, we will have a question and answer. So please feel free to share your questions on the Q&A question and answer panel. And for sure, we're gonna convey your questions to the speakers. And we're really excited to get your questions. Without further ado, I'm gonna just ask Courtney to describe SIOP Nursing Network as the chair of our network. So Courtney, the floor is yours.
Thank you so much, Mohammed, and thank you, Natalie, for coordinating this webinar. So as Mohammed mentioned, and as many of you know, my name is Dr. Courtney Sullivan. I am currently the chair of the SIOP Nursing Network and Steering Group, and I'm also a postdoctoral research fellow at the University of Alabama at Birmingham. My work has focused in pediatric oncology in the clinical setting and then internationally for the last 10 years. So it's a great pleasure today to be with you in this capacity for the SIOP Nursing Network. So the SIOP Nursing Network is a global community of nurses as well as other health professionals who are passionate about the care of children and adolescents with cancer and their families across the care continuum. And all SIOP members who are nurses are a part of our network. Next, please. Our current steering group is shown here. We have a fantastic group that leads the work that we do. Next. And currently, the network has over 500 members from over 75 countries. So we are continuing to grow at a rapid pace. But it's wonderful to see the nurses as well as other health professionals that have joined us to advance our mission. And next, I'll hand it over to Natalie.
Thank you, Courtney. Given that we're talking about the current sort of nursing issues, I think we just want to take a moment to acknowledge the impact of COVID-19 across the whole nursing workforce. It's challenged us in so many different ways, and this has included needing to manage restrictions in hospitals and the different communities where we work, redeployment of staff, delays in planned treatment for some of our patients, access to PPE, and that widening gap between nurses being available for direct patient care and nurses that are needed to provide care. This has really increased the complexity that nurses have had to face with delivering treatment. So we did a study in Australia here where we just asked about how people were feeling, and it really highlighted the moral distress that nurses faced when they felt that they weren't able to deliver the quality of care that they really wanted to because of the impact of COVID. So at this time, when we're really facing some of these challenges, it makes being a member of organizations such as SIOP even more important, and the role that having a network and a community can really bring to supporting each other through some of these challenges and advocating and educating others about the work that we do. It becomes really important. Next, thank you, Mohammed. So there's a number of ways that we can think about addressing these workforce challenges, and some of this was highlighted by a paper recently published by Julia Challenor, where some of this has come from. And that really, to address some of these challenges, we need to think about ways that we can attract and retain nurses in the field, promoting the positive aspects of pediatric cancer nursing that we've all experienced in our day-to-day practice, and how being part of a team can really help us to feel that this is the work that they're wanting to do. Promoting the actions of being part of a professional organization such as SIOP are really important and pivotal in supporting the workforce. And this is why events such as this are so important. Also, being able to connect with colleagues across the globe is a really wonderful way to develop networks and through SIOP, we can make these lifelong connections. And we heard a lot of that in the previous webinar about the past. Investing in education is also a really important way that we can support the workforce. Pediatric oncology nursing is still not recognized as a specialty in many different countries. And so advocacy is really required to address this. And again, this is where the SIOP nursing can really come into play. And then we also need to look at strengthening leadership and promoting the voice of the nurse in decision-making, recognizing the importance of nursing research, education, and nursing mentorship. Next slide, please. So when we think about leadership, what are we talking about? And we can define that as the ability to achieve a collaborative effort, enabling people to work together to achieve common goals. And importantly, nursing leaders are required at all levels of the health system. So it's not about your position that you're working in, it's really about what you're bringing to your work. Family-centered and culturally safe, evidence-based care cannot be delivered without nurses and nurse leaders. And nurse leaders are really at all of these different aspects. So we find nurse leaders at the clinical, cold-face, delivering clinical care, questioning why and how we do things. We find nurse leaders in education, passing on that knowledge and experience to train the next generation. We find nurse leaders in research, tackling clinical problems and developing new knowledge. We find nurse leaders in policy, advocating for change and ensuring that care is delivered according to standards, and nurse leaders in administration, leading that management and day-to-day delivery of the complex care that's needed in children's cancer nursing. Next slide, please. So I just wanted to highlight here, these are some articles that have been published by some of our nurse leaders. Certainly in the middle there, we've got some particularly around pediatric oncology nursing. And these papers are really calling us to it's a call to action and a call to lead. And this was coming from many voices. As a member of SIOP, you have access to all of these papers through Societo, a benefit that we have as being part of the organisation. And I'd really encourage you to have a look at some of these papers, to read them and to share them with your colleagues as a way to inspire and think about how you can act as leaders in your own workplace. Next slide, please. These opportunities for leadership are at all levels of the nursing practice, from newly qualified to expert, and they can be demonstrated in everyday activities such as modelling the way for others, inspiring that shared vision, challenging processes and that critical thinking about why we do things and how we do things, and reflecting on how we can change. Having that culture of inquiry is really important. Enabling others to act to the maximum capacity, and encouraging and empowering wherever we can. That advocacy is really important. So I'll hand back now over to Mohammed, who's going to talk about what we've achieved in the nursing network throughout 2022.
Okay, thank you so very much, Natalie. That was very inspiring. And so let me start first by how does SIOP, to talk about how does SIOP Nursing Network contribute to the overall SIOP mission, and how can you be involved. So in 2022, last year, it was very formative year for Nursing Network. We developed the 5-year strategic plan, which is like a milestone for us. We supported also the development of baseline standard strategic plan, updated our terms of reference, initiated formative discussions with network and continental leaders, nursing leaders. We published a statement of support for Ukraine healthcare workers, and planned the annual Nursing Congress program. And this is like on annual basis, we're doing this. This year, we offered ambassadors or guides for the first time, attendees We are grateful that Foundation S funded 28 nursing scholarship and the My Child Matter Nursing Awards. We convened the SIOP Nursing Legacy Group with past steering group members, and currently we're working on a project to document the history of, or they're doing working on documenting the history of SIOP nursing. We established social media presence and launched the SIOP Nursing QI scholarships or SIOP QI Scholars Program. Many activities are going on, and to be very honest, it was really very challenging to like feature the most important activities that we're doing, and that's why it was very difficult to us for us to choose which activity that to shed lights on today and to invite speaker to. So, but eventually our work at SIOP Nursing, all the activities are very important to us, and it contributes to our mission and SIOP mission as well. So another important, again, I mentioned the strategic plan, but this is something that we need to keep highlighting because it's a milestone for us. So the process involved numerous stakeholders and was launched in September last year. So I will not discuss that much about strategic plan because we're gonna feature our strategic plan in our next webinar about future of SIOP nursing. So hold your horses for now. So and join us in the next webinar to learn more about the strategic plan. At SIOP, we offers and SIOP offers many opportunities for members to get involved in committees, including, as you can see on the screen, you can be involved in the advocacy committee, Congress development, education, training, finance, governance, membership, program for advocating research capacity, publications and endorsements, and scientific committee. So as a member of SIOP, you can, if you have the expertise and the, let's say the courage to be among other SIOP members, so please do so. And there are many opportunities to be involved in SIOP. Also, there are there are many networks within SIOP, within SIOP, and those are like the networks that we have at SIOP that you could contribute in. We have a global health networks, nutrition, supportive care, psycho-oncology, nursing, young SIOP, and women leaders. And within these networks, there are working groups that you can join or even lead based on your expertise. So nurses are active all over the networks in a multidisciplinary environment. For example, that I am a nurse and I'm co-sharing one of the Global Health Network working group, which is traditional and complementary medicine. But also within Global Health Networks, we have a nursing working group, which is one of the most active working group within Global Health Network. As usual, nurses, they're active everywhere. So if you have the again, if you'd like to be involved, please you can reach out to the co-chairs of the networks or the working groups and be involved as much as you can. Okay, we also put here in this slide more examples on where nurses are involved and how nurses are involved in SIOP at all levels and across many committees and networks. And you too can be involved. So if you have any question about how to get involved, and if you think that you would like to participate or to contribute in a way or another, for sure, you can reach out, and I guess our nursing steering group members would love to help all nurses to get involved in SIOP. Okay, so now we got to the excited part of having our speakers to discuss the topics that we plan to discuss today. So our first speaker and panelist, Dr. Marilyn Hockenberry. Dr. Hockenberry is a member of the SIOP Scientific Committee and the Nursing Steering Group, and also she's the Director of Global Hope Nursing and a tenured Professor of Pediatrics at Baylor College of Medicine. Dr. Hockenberry is also the Miss Baker Professor Emerita of Nursing at Duke. So I'm gonna stop my screen, Marilyn, and let you just share your screen. So the floor is yours, Marilyn.
Hello, everybody. Can you see my screen? I think we're all set. Just
Yes,
let me know.
perfect.
Okay, great. Great. So welcome, everybody. It's really a pleasure to talk to you about two of the things that I'm involved in with many other SIOP nursing members. The first thing we're going to discuss is the SIOP Quality Improvement Nurse Scholars Program. I think you remember that we had a call out last year for teams to actually apply to become a member of the Nursing Scholars Program. This is through SIOP Nursing, and it really teaches the principles of quality improvement. It's designed to really provide our nurses and our interdisciplinary teams the skills that really need to be implemented to improve quality care. And we launched it in February. I'm really excited to say that things are going very well. I'll show you the teams in a minute. We will have an interactive session at the Congress in Ottawa that I hope all of you will be able to attend, because the scholars teams will actually be presenting. So we have 4 teams that were selected, and each scholar has their own project, and I'll tell you more about that. Just a word about what these individuals are learning throughout this scholars program. They have an online course. They are learning about QI in a formal course where they actually have to take quizzes. They have to develop their projects. They explore QI designs. As you can see here, we're teaching them how to write specific SMART aims. And then they're really looking at measures that can accurately influence change. And then how do we actually measure those? And then we've just finished evaluating the re-aim framework, learning about that to measure QI effectiveness. We just met together to learn how important it is to really measure practice change. Here are our projects, and I just do want to go through and say a word about each one. Golrez from Pakistan is leading a group that's looking at easing the orientation and waiting times of pediatric oncology patients receiving treatment in a daycare center. I can also say that all of these teams come together every other week with us, with our mentors that you'll see on the right. And so it's not just the QI scholar that attends, and it really does represent a team approach to quality improvement. I am the mentor for that project. We have a wonderful team out of Ghana that Mavis is the lead on with her other members who come faithfully every other week with her to continue discussing QI. Her project is implementation of pediatric early warning scores at the Pediatric Hematology Oncology Unit Emergency Ward of GAR. And Dr. Karen Gibbs is the mentor for that team. Then we have improving Wendy out of Ghana with her team, who are also very, very involved with her. Their project is improving intravenous fluid monitoring and documentation among nurses on the pediatric oncology ward of Korobu Teaching Hospital in Ghana. And Lisa Morrissey and Dr. Glenn Baugh are the leads for mentors for that group. And then last, we have Preeti, who is out of India with her team, who is also very active with her And the project is Pediatric Oncology, New Onboarding, Nursing Orientation, and Post-Orientation Practices, Improving Skills and Implementation of SOPs. And Dr. Sarah Day, and then Rihanna and Linda, that's with us today, are all mentors for that team. And so let me just point out 2 of the 4 projects are from the baseline standards focus. And we're really excited about sharing this work with you when we meet together in the fall. So with that, I have the pleasure of talking a little bit about what things are going to be happening in Ottawa. And let me start by saying I represent YY, who is a coordinator of Education Day, but we wanted to share some of the highlights that will occur on Wednesday before the general sessions begin. We have a joint session with supportive care on optimizing supportive care, an update on latest evidence and guidelines. And then we have a joint session with numerous networks within SIOP, and you see them listed here, on incorporating a family-centered care approach in pediatric oncology. There are 2 featured workshops on that day that I think nurses will be very interested in. One is on oncology emergencies, fundamentals of simulation-based healthcare education. And then we'll also be doing an introduction to quality improvement, establishing a QI work plan for individuals that are very interested in implementing QI at their site. One thing I did want to let you know, some of the members are here with us today. I'm very excited about having a nursing working group for our SIOP program now. I think if you remember, we had a call for individuals that might be interested in joining this working group. It's a very good example of what Mohammed was talking about, with opportunities for individuals to get involved in SIOP. As you see here, we have Noor from Indonesia, Remzi from Turkey, Yuliani from Indonesia, Joanne's from Uganda, and Lindsay is from Canada. And of course, YY from Singapore not only coordinates Education Day, but she also helps with the program organization for the general sessions. And it's made such a difference this year, having this group of excited individuals come together and really help plan. And I think you're going to notice it in Ottawa in October. Just a couple highlights, a few things to let you know what's going to be happening with our SIOP General Nursing Session. We have 2 keynote speakers this year. One is Dr. Pergert, who is going to be talking about ethical dilemmas in clinical ethics, specific for peds oncology nurses. And then Sue Zupanak, who many of you know, is also going to be presenting on symptom complexity in pediatric cancer. The time for nursing action is now. We will have an entire symposium within the nursing group on improvement science, and I'm really excited, as I mentioned previously, our scholars, all 4 scholars, will be presenting their projects, and then the mentors also will be commenting, and it will be a great session to learn more about improvement science. We have 32 oral abstracts presentations that are going to be throughout the 3 days. We have roundtable luncheon again this year. We have 18 topics for discussion. And I might say that if any of you have registered yet, you will receive information from SIOP about how to sign up for those roundtable luncheons, so that we'll make sure everybody's assigned before that, before you arrive. A new thing we're having this year with Dr. Lindsay Jibb, and I think Remzi's helping with that as well, is an interactive poster session on the second evening when posters are going to be available, and we'll have 3 or 4 that we'll actually discuss. So it'll be a new kind of thing to really experience within nursing for us this year. Of course, we have a business meeting that we want all of you to attend. And then our Nursing Ambassador program is going to be launched again for all first-time nurse attendees. We're going to have more information sent out from SIOP about that. And my plan is to have first-time attendees actually be contacted this year before they arrive from their ambassadors. And we'll be working on that this summer. Last but not least, we have 2 general sessions that are really nursing led or nursing supported. We'll have a keynote 7 on building resilience to reduce stress among children with cancer and their families by Dr. Sherry Robb out of Indiana University. And then very excited, we have Dr. Lindsay Jibb, who is on our program planning committee, was chosen for a general symposium on advancing healthcare technology to improve outcomes from the perspective of clinicians, patients, and families. And that will be built into our schedule so that all nurses can attend and support them. And that is it. And I'll pass it back to Mohammed.
So thank you, Marilyn. That's amazing to hear what's going to be happening in Ottawa. It sounds like such an exciting program. But now we're going to hear from Lorena. So Lorena is a St. Jude's Global Nursing Project Coordinator, originally from Chile, certified in pediatric hemo-oncology by the ONCC, and she has more than 16 years of promoting nursing excellence in Latin America, introducing the nurse educator role, pioneering an initiative through the region and through different educated and QI projects. Lorena is an active member of the AFON Spanish Chemotherapy Biotherapy Committee, which worked to adapt and pilot the chemotherapy biotherapy provider instructor course in Latin American countries. So Lorena, I'm very happy to hand over to you so you can talk to us about the Spanish highlights.
Yeah. Thank you, Natalie, and welcome everyone to this amazing session. For the next minutes, I would like to share with you another initiative we developed during 2022. During the last quarter of last year, a task force was formed to organize a webinar to share the SIOP 2022 nursing program highlights in Spanish to make it available to Spanish-speaking nurses all around the world. Finally, in February of this year, we ran a 2-part session language webinar series featuring highlights from the SIOP 2022 Nursing Congress program in Barcelona, Spain. In the first session, attendees learned about the SIOP Nursing Network and its strategic plan, the SIOP 2022 nursing program activities, the top 4 scoring nursing abstracts, and the SIOP baseline standards for pediatric oncology and their implementation in resource-limited countries. In session 2, participants had Professor Julia Downing's closing keynote presentation called Innovations in Palliative Care, Public Policy and International Advocacy, completely in Spanish. This presentation was followed by a live and interpreter question and answer session with Professor Downing. A total of 89 nurses from Mexico, Central and South America, from Spain and Switzerland participated in these sessions. This activity is part of the strategic plan of the SIOP Nursing Network, which aims to promote and disseminate professional development opportunities for nurses in English and other languages. We are committed to continue to develop these and other activities and extend it also to other languages. Thank you. Mohammed or Natalie?
Thank you so very much, Lorena. So Lorena and I worked together at St. Jude Children's Research Hospital, and I can remember how Lorena made a difference, and her contribution in Latin America in pediatric oncology is very prominent. So thank you so very much, Lorena, for all your efforts. Let me go now to the next speaker. Our next speaker is Shelby Sandoval. I'm sorry for not.
That's perfect. No, that's good.
Okay, great. Thank you. being from different culture, it's really difficult. I know you cannot pronounce my last name also.
You are correct on that.
So Shelby is the current co-chair of the Global Health Network Nursing Working Group. She has been in the pediatric oncology nursing field for 13 years and has held many roles from bedside to management. For the past 6 years, Shelby has worked with pediatric oncology nurses in Vietnam in supporting continuing education, professional development, and the implementation of the baseline standards. Also, Shelby is a colleague at the Global Health Networks. She's co-chairing, as I mentioned, one of the most active working group at Global Health Network. So I will let you, Shelby, to speak to what you're doing at Global Health Network and your great work in pediatric oncology. So handing to you.
Thank you. Oh, great. You have my slide. Oh, wonderful. Thank you. So as Mohammed said, I am Shelby Sandoval, and I am one of the co-chairs of the Global Health Network Nursing Working Group. And I just wanted to share a little bit about what we have done over the last year. So this working group, we really have a focus on both nursing education and engagement. And so we have been doing monthly meetings based on need areas that were identified by members. We actually sent out an English and Spanish educational needs survey to our members in November of 2022, and we got great feedback on what our members really want to learn more about. So we also decided to change the design of our meetings to more of a journal club and case study format in December of 2022. And we've done that for the last 4 meetings. Our next upcoming meeting is going to be on May 18th, 2023, and it's going to focus on self-care for pediatric oncology healthcare professionals. And we'll have Dr. Leanne Embry from University of Texas, San Antonio be our speaker for that, who's also an active member in SIOP. Some of the other topics that we've learned about this year in our Global Health Network Nursing Working Group, we've talked about best practices in nursing communication, case studies on oncologic emergencies, and our latest amazing presentation from Courtney, which was Tell Someone I'm Here, giving voice to children with cancer and the nurses who care for them. In terms of member engagement, in September 2022, we released Volume 5 of the Global Health Network Nursing Working Group newsletter, Making Global Connections, which is always a favorite among our members. We also created and distributed Pediatric Oncology Nursing Day poster in 13 languages in September of 2022. Our working group also provides assistance with nursing membership through sponsorship. And we share scholarships and other opportunities on our social media apps and our WhatsApp. So we have Facebook, WhatsApp, Twitter. And I think that's all I have. So we would love to have you if you're not a member. It's a great group. And like Mohammed said, a very active group. Thank you.
So our next speaker today is Linda Abramovitz, who probably doesn't need any introduction. She's so well known to so many of you. But Linda is an adjunct associate clinical professor with the University of California, San Francisco, UCSF. Her career started as a pediatric bone marrow transplant oncology clinical nurse specialist. And she's really focused on improving care for pediatric oncology and transplant patients and supporting nurses in providing this specialist care. So raising the standards and the profile of nursing in low and middle income countries has been a really important focus of her practice. Linda is a fellow in the Academy of American Academy of Nursing. She currently serves as chair on the AFON Global Outreach Committee, and she's passionately advocates for nurses globally via her work with SIOP, particularly around the baseline standards, which we're going to hear about more today. And Linda is also the recipient of the SIOP 2023 Nursing Leadership Award in recognition of this substantial work that she has contributed towards SIOP nursing. So I'll hand over to you, Linda.
Linda, we can't hear you.
I'm going to unmute. Can you hear me now?
Yes, thank you.
Okay, I have a computer and a phone going, so this is all good. So I have the pleasure of presenting briefly, which is difficult, on the baseline nursing standards. Mohammed, next slide, please. And so I'd like to give an overview of the standards in 1 minute, and then really share with you the relevance of these standards for SIOP nursing, and then a few activities that we have currently been involved with. Next slide. So the baseline standards actually started as a position paper from a group that met in London in 2012, and this position paper was published by Day et al. In Lancet Oncology in 2014. Next slide. From there, we were able to publish again in 2015 in Cancer Control the baseline standards in a more descriptive article. And for many of you, you've seen these standards, that there are 6 of them. It's base staffing, orientation, continuing ed, functioning as a multidisciplinary team, resources for safe care, and then evidence-based practice. And I don't have the time to go into this, but these are the standards that we have based our work on. Next slide. So in 2015, there was decision after these 2 publications to develop a task force. And this is the current members of our task force that represent nurses, SIOP nurses, from high income as well as low, middle, or limited resource countries. And this group, over the years, which have really contributed and continue to disseminate and expand on the standards. Next slide. Our journey has been a process, and then we had the opportunity to present in Barcelona, and we talked about where we have come over the years. Next slide, please. This is a timeline that I presented at that time, and you can see the many activities that have gone on through the years, including developing an advocacy toolkit, having workshops on advocacy, having a presence on the website with our own information. And then finally, in 2020, we spent the year focusing on the different components of the standards as it relates to advocacy, research, and implementation. And from there, we developed a 5-year strategic plan. Next slide. During this time when we were working on the strategic plan, we created and made sure our vision and mission aligned with SIOP, but more importantly, with the nursing network at SIOP, that they would align with the activities and the mission that we were going to move forward on in terms of conducting global collaboration to promote the standards related to 3 components: the advocacy, research, and implementation. And of course, looking at the WHO Global Initiative for Childhood Cancer was also key as we moved this work forward. Next slide. So the 5-year strategic plan, just very briefly, focuses on those 3 pillars, really with a focus of increasing knowledge and awareness, collaborating not only with the nurses within SIOP, but looking at other members that would have an influence in disseminating the standards and creating the ability to implement them globally, including physicians, parents, other stakeholders, including this ministries of health globally. We continue to look at the current scientific evidence to support each of the standards, and we are having discussions about possibly updating the standards. Finally, implementation is a huge piece of this through education and mentorship opportunities, which Dr. Hockenberry already discussed, was the involvement of the baseline standards in the QI project that is currently being implemented. Next slide. So in summary, some of the activities over the last year has included a presence at our SIOP conference in Barcelona. We had an opportunity to have a symposium, participated as a roundtable. We also had the first time given an opportunity to have a best abstract, and this continues into this year's conference. As you already heard, there's 2 QI projects that are focused on the standards that are ongoing, which includes mentorship, which was an important piece of what the task force wanted to continue to work on. And then finally, we are in the process of writing a manuscript for publication. And this was really a look back over the last 10 years on what the task force has accomplished in terms of publications, presentations, on endorsements, which we are continue to work on, advocacy toolkit, and then implementation and looking at site initiatives globally. And of course, we are excited about our future directions and plans coming down the road. Next slide. So the global initiative really includes getting SIOP members involved. And we want to embrace the future as we move forward. The website will be updated, but to start, if you're not familiar with the standards, please visit the website for more information. And we have chairs of each of our working groups, which is Advocacy, Research, Implementation, and we will be engaging as the year progresses members of SIOP to work with us on many areas of implementation, endorsement, and advocacy. And we would love everyone to be a voice for the standards to move this initiative along. Thank you.
Thank you. Thank you so much, Linda, for describing this amazing work and promising work of the nursing standards. We really appreciate your efforts and the team on this. So now I'm gonna introduce our last speaker for today, Dr. Julia Schellner, the SIOP Secretary General. And probably Julia doesn't need introduction. I have here like a long bio, but I'm gonna just mention some of Dr. Schellner's work. So Dr. Schellner serves as a consultant for multiple international projects for childhood cancer and pediatric oncology nursing, including the AFON Spanish chemotherapy biotherapy course in Latin America. She was the education liaison for children with cancer and those who had survived their disease at the University of California, San Francisco from 1993 to 2003. Dr. Schellner had many contribution in scientific publication, and I had the pleasure to work with Dr. Schellner on 2 papers that was published during COVID-19. So thank you so much for the opportunity, and thank you so much for being here, Julia. So I'm gonna just turn it to you, and I'm gonna stop sharing my screen. You can share your slides.
Super. Thank you so much, Mohammed, for that elegant introduction. And it's such a pleasure to be here today with everyone. I'm going to go ahead and share my screen because I don't have slides. I'm going to show you a website. So let's see how this goes. And let me see if I can diminish this so you can see it. I'm here today to share with you the My Child Matters program. It's conducted by the Foundation S, the Sanofi Collective. It's the only group we know that is actually funding nursing projects at a substantial level continuously since 2015, I think was the first group we had. And they started at $5,000. It was a 1-year support for nursing project. And now you can see here it's grown. Now they used to have a separate map for nursing projects only. And then they said, well, why aren't we putting them all together with the physician projects? So I'm going to put this URL in the chat so you can find it. This is not an easy map to find. I'm going to show you how I'm going to backtrack out of it so you can see how to get there yourself. But actually, let me put this in the chat right now before I forget, because it is not a simple page to find. And we've asked them to please, oh, sorry, I can't do it. I'm not in the right chat. Okay. Maybe Courtney or somebody can grab, hold on, I'll do it when.
We can send this out after the webinar.
Can you? That would
with
be
the
great
email.
because
Mhm.
I would love people to go look at it. This is the number of projects overall. This is, you can see they start with the nursing projects. I just want you to know, some of you may know Nita. Nita is a physician, but this project was run by a nurse. Nita just actually helped the nurse write the project application. So you can see the amount of funding. You can see by the title what was going on. Here you're going to see a lot of times children impacted 1. That's a placeholder. It's not true that it was only 1, because many of the projects for nursing are education oriented. You'll see this one, professional education course for nurses in pediatric oncology and hematology in Ukraine. So you can look when it will then go to, if it's a physician award, then it's here without the word nurse, but keep going down. And you will start to see again, the nursing projects jump up again because they're listed here by year. Here, nursing awards down here. So this has been incredibly inspirational. This year, it was changed to a 3-year award for €5,000 per year. Also, we reinstituted that upper middle income country nurses could apply. The call usually comes out in December. And the deadline for applications we try to make simple, is about, I think it was this year in February, and we reviewed it immediately right after, so the announcement was made in March. We had 29 applications this year. They're available in French or in Spanish or in English. We have reviewers who can review it in those languages. And we were very excited. We got 10 winners. They're getting ready to get started. Like I said, it runs over 3 years. Most projects tend to be education, but the 3 categories are education, nursing practice, or research. We don't see many that come in for research, so I'm very excited about the QI project that Marilyn and team are running out of the SIOP nursing office, because I think that is going to help us get applications for more research-oriented projects. If you have any questions, you're welcome to contact the SIOP Nursing Steering Committee. You're welcome to contact me, because we will really hope we get more and more applications. They're getting better and better. The nurses with the award, it includes support to attend the SIOP conference and to present your project in a short form, not an abstract form, but a very short form, to keep us apprised of what people are doing across the world. Does anybody have any questions? I'm going to stop. Oh, I told you I would show you how to get to this map. Let me show you going backwards. So this is the My Child Matters Foundation S page. You can get more information here. And then you go, I don't even think I can go, I don't think it'll go further back. But if you Google it, you need to Google My Child Matters Foundation S. Okay, and then here it says explore our project map. We've asked them to please make the button a little more obvious so you can get there quicker and you can learn more about the project. But we're very excited to be partners with this foundation. They've given incredible support. They support other initiatives within SIOP. But this truly is the first people that have actually, the first group that has come, foundation that's come together and supported nursing specifically. and nursing in low and middle income countries, and now upper middle income countries. They were removed initially because there were just overwhelming amount of applications. There were 69 applications one year. So they said they wanted to, it had another name before. They said they wanted to focus in low and lower middle because there was such great need, but now upper middle income countries are back. So as eligible. So please, the next call for applications, thanks Linda for the question, would be, it'll be next year, probably January. So be on the lookout for it. And you will probably see some information about Foundation S if you come to Ottawa or you attend virtually, because you'll see the awardees presenting in the nursing sessions there as well. So please consider sending an application. And this is it's the other thing that's unique is you can apply in a non-English language, which is, we hope, making it more accessible for nurses to step up. And we are also, this next year, we realize filling out an application for a grant is not something many nurses are familiar with. We're going to put in more support. So we're going to offer a mentorship. Obviously, the mentor can't help review and score your application, but we really think that a mentor could help. We saw some fantastic ideas, but the grant application was so wasn't strong enough to be funded, but the idea was fantastic. So we're also going to try to hold a seminar, a webinar, where we asked her questions about how do you fill this out, this application to be stronger, and any guidance that you need, because we think that we're just overwhelmed by the great ideas and imagination of these nurses and the willingness of the projects they're putting together and the impact it's going to have on families and children. So thanks a million.
Thank you so very much, Julia. So there is a very quick question I got from the Q&A. Apparently, this is for you. From Mariam. She asked, can academic research be funded? Do you have a quick answer for that?
Yes. So if you have a research project and you submit it under the My Child Matters award scheme, then yes, it can be considered as competitive. And if it scores high enough, it'll be funded. So if you mean by academic research, an actual research project, yes, that is eligible. And we'd love to see it. We haven't seen many people even apply for a research project. So I would have to say that the competition is probably lower in research than it is in education and practice.
Yeah, thank you so much. So, yeah, go ahead, Nihal.
Yeah, so wonderful to hear that, yeah, this type of initiative coming forward. And I can't wait to hear about some of the impact that this has. And, you know, this is the type of thing that we can look forward to hearing about in the future. And we have got a Future of SIOP Nursing webinar coming up in June. It'll be too soon to hear about some of these initiatives, but it would be so exciting, Julia, to just hear about some of your experience and how you've seen global pediatric oncology change over the years. It's, yeah, really inspiring to think that, you know, a difference can be made. So we have this next webinar coming up in June. It'll be the final one from our series of the past, present, and future. So please look out for when that's going to be advertised. The details should be out shortly. And we are at time. The hour has gone by way too quickly. We haven't had nearly enough time for discussion, questions, and answers. But thank you all very much for joining us. And we look forward to connecting with you again soon. Please, if you're not members, go ahead and join up to SIOP. There's QR codes there where you can join up to the social media networks or onto our webpage, or if you're on the website, make sure that you tick to be a part of a member of the nursing network. Thank you all. We look forward to connecting with you again soon.
Yeah, thank you so very much, everyone. And thank you for our speaker and panelists. Sorry again for not being able to get more questions, and see you next, or the next webinar.